Today is our first session of our PLCS Empowerment sessions, and we are so excited to have you all with us today. We are talking about understanding anxiety and depression. And so we'll just talk about kind of do some rough or some basic definitions, and then we'll move into some strategies and then what you can do as parents at home to help support your students. If you have any questions along the way, please feel free to drop them in the chat, and then we will address those at the end as we have time for that. So today we will do our presenters. My name is Emily Arkfeld. I am a school social worker here in Papillion. I am housed at Liberty Middle School, and then I have the feeder elementaries, Patriot, Parkview, Ashbury, and Prairie Queen, and also our YATP, our young adult program, and PLEC, our early childhood program.
My name is Justine Clemenger. I am a school counselor for an elementary school in the district. I am at Ashbury Elementary. And I've been a school counselor for, this is my 10th year as a school counselor. I've been in education for 17 years, so have some experience.
I'm Vern Davis-Showell. I'm the school psychologist at Papillion La Vista High School, and I have been at Papillion La Vista High School since 1999. So I think I win in the experience column.
Perfect. Thank you both. All right, so let's move into some definitions. We're going to start today with talking about what is anxiety. So in the nation, about 11% of children's age 3 to 17 have been diagnosed with anxiety. And then that 13 to 17 age range is the highest with about 20%. It is the most common mental health diagnosis and problem in children's ages K through 12 or grades K through 12. And really, all of us experience worry and fear and nervousness, and generally, they are a healthy and normal response to certain situations. It becomes problematic when it occurs in excess, in the wrong place, at the wrong time, and then when it starts interfering with that daily functioning. So when we talk about that 11% and 20%, those are kids who have reached that clinical level of diagnosis and not just our general, like, oh, I'm anxious or oh, I'm nervous type of things. So they have been diagnosed with it by a doctor or psychiatrist or psychologist. When we think about our kids and anxiety, when our children start to avoid situations because they want to alleviate that worry short term, that really kind of just becomes a snowball effect where it turns into a more of a problem long term. And then over time, it causes that anxiety to worsen because we have avoided something. We feel better short term, but then when we go to do that thing the next time, we're like, oh, but remember when we did that, when we avoided it last time and we felt better. And so we continue just to add on and avoid things that make us feel worried or nervous about that. When we think about children who avoid school or trying new experiences, they miss out on those great opportunities for social connection. They may miss out on the social skills needed to help navigate the world as they continue on in school and beyond that. And then sometimes we get in that all or nothing view where we either have to be really good at something or we can't do it at all. And so that tends to kind of roll into some of that perfectionism tendencies where we avoid or repeat tasks, which can impact that learning. And unfortunately, what research has shown us is that untreated anxiety is one of the biggest predictors in developing depression in the teen years and into adulthood. Vern, if you want to bounce on, we'll do our depression definition. So when we're talking statistics again, 4% of children ages 3 to 17 have a current diagnosed depression. So again, have met that clinical level of depression for that diagnosis. And again, our older adolescent teens are the ones who have the higher numbers of that. So nearly 9% for that. So definitely lower numbers than we're seeing in anxiety. However, lots of research has also shown us that while some of our kids don't necessarily meet that clinical level for diagnosis, they are still struggling with sadness and hopelessness. So a recent study showed 42% of teens experience persistent feelings of sadness and hopelessness, and 3 in 5 teen girls reported feeling sadness every day for the last 2 weeks. So similar to anxiety, right? All of our kids have bad days. They get sad about things. They experience moodiness. They may have a fight with a friend or things aren't going well at home and so are struggling. And again, it becomes concerning when we see really those prolonged or drastic changes in mood and affect. And so some of those things that we want to make sure that we are looking out for is just that overall negative outlook about things where there is no hope, everything is bad, nothing will ever get better. They've got low energy or effort, so things maybe they used to have an interest in and enjoyed, perhaps they have stopped enjoying that. They stopped doing those things, looking for drastic and ongoing changes in sleep and eating, a change in school. So perhaps they had been doing well in school and wanting to go to school, and so then grades are starting to slip. If you see them starting to pull away from friends and family, engaging in risky or harmful behaviors, and then we also want to make sure we're looking out for any thoughts or talk of suicide as well when we're talking about depression. So when we think about anxiety and depression, there are lots of things that overlap in those symptoms. So we've got restlessness, trouble concentrating, it's that excessive worry. Maybe we've got complaints about stomach aches or headaches. Maybe we have kids who are popping into the nurse daily or multiple times a day because they've got those somatic complaints where something seems to be wrong, but there really is we can't find a medical reason for that. And that agitation. So sometimes we see that irritability and agitation come out for some of the symptoms that overlap for that depression and anxiety. So the best bet is to work with a medical provider or mental health provider to kind of hash out what might really be going on because of those overlaps. So when we think about depression, that's where we see those higher rates of irritability and sadness and fatigue and just kind of more lethargic, again, that they have less of an interest in doing things they used to enjoy doing, spending time with friends, isolating from family and friends. And then on that anxiety place, or on the anxiety side, you can see more of maybe they've got trembling or flushed cheeks, feeling nervous or powerless, that elevated heart rate, panic attacks we see a lot of the time with anxiety, especially those high rates of anxiety. So this is just a nice graphic to kind of show what some of the symptoms are for both, but really how they overlap. We have seen that nearly a half to 3/4 of individuals who are diagnosed with depression also have been diagnosed with anxiety. They tend to, again, not only have some of the same symptoms, but we talked about that untreated anxiety can lead to depression later on. Genetics, temperament, stressful life events, they all can increase the risk of developing these disorders. And again, that unchecked anxiety can lead to maybe some isolation and withdrawal, which intensifies that peer rejection and the feeling of loneliness. And so that's how we part of how we can get to depression down the road when we aren't dealing with that anxiety at a younger age. And there are lots of factors. Again, we talk about genetics, we talk about temperament, we talk about maybe we've experienced something in our lives that can lead to this, but there's a lot of different things that have an impact on our mental health. And so we think about perhaps unrealistic personal, academic, social, or family expectations can create that anxiety about trying to meet them. If we don't meet them, then that can lead to that sense of rejection or disappointment, or they disappointed in themselves, or they feel that they have disappointed others. And we know that what we have seen and what we have seen in our doors here is that our kids who struggle with those feelings of disappointment or not wanting to disappoint others and loved ones, they internalize that. And so they start to feel bad about themselves, which can then increase that anxiety and depression symptoms. Our kids, when things go wrong, we talk about that negative outlook on things. And so when things go wrong, if they don't have good coping strategies and good support systems, they can feel that life's not fair and things never go their way and can spiral sometimes in that. Thinking about extracurricular activities, generally, we know that those are wonderful things to be a part of, and we want to encourage our kids to be connected for the social piece with their peers, to have positive adult role models in their life. But we also have seen a shift, I think, in our sports culture where we are overscheduling kids and placing really high expectations on them at a young age where they have to be better and the best. And so not only are you playing a sport or playing an instrument, but then you have lessons, extra lessons on the, outside of that. And so we're putting a lot of pressure on our kids to be better and to be the best. and we can be overscheduling them, which can lead to that anxiety or those feelings of disappointment if they're not meeting those expectations. Social media is there's so much information out there about social media. There are definitely pros to social media. And one of those pros, I think, is that there is more information about mental health out there. Sometimes there is misinformation about mental health out there. And so our kids sometimes can latch on to that and maybe not in the best way. But also just that if you are doom scrolling late at night and you can get caught in some of those, there's a lot of negativity on social media. And so it's easy to kind of get caught in that. And we all know your algorithm, once you look at one thing, it's going to show you 100 more things that are just like that. There is that impact, especially for females, where they're seeing maybe unrealistic expectations of what a female body should look like and comparing themselves to that and saying, I don't look like that. Something must be wrong with me. We see that impact on cyberbullying. So kids having access through social media and through phones in a way that we didn't, 15, 20 years ago. And then just seeing also there's a lot of just negativity on social media. And so hearing that directed to perhaps friends or to people like females or males or people of the same culture and people of the same backgrounds. And so that can be, sometimes we can internalize that as well. So really, again, lots of cultural pieces. There are great things. It's okay to have high expectations for your kids and want them to do well, but we need to just caution when that becomes perhaps too much, or if we're starting to see signs that it's leading to some anxiety or depression symptoms, and then having a conversation about what we might want to do or what we might be able to do to help kind of quell some of that. So this is the end of my section. Justine or Vern, do you have anything else to add to that society and culture part?
I do not specifically, but I feel like a lot of what I have to say kind of builds off of what you had already said. So I can go ahead unless Vern, you had something to say.
Nope, I'm good. Go ahead, Justine.
Well, I was going to speak to the signs that we might see, and Emily already spoke a little bit about this, but what this might look like in our kids. And we broke it up between ages, so pre-K and elementary, middle, and then high school. However, I do want to say that the these signs you can see them all across the board in a young child or a high school student. I feel like you might see all of them or some of them that we have in elementary, you might see in a high schooler. So I'll start with in pre-K and elementary. Um, Decreases independence and belief in self. So children might become more dependent on adults, lose confidence in their own abilities. Invalidating, by that, we mean they might feel like their thoughts or their feelings don't matter, or they might feel misunderstood or nobody understands them. Can decrease communication. They may talk less, avoid sharing their feelings. Creates a sense of obligation. Sometimes children that show signs of anxiety feel the pressure to act a certain way or to please others and to do something in a way that is going to make parents happy or adults happy. In middle school, shifts locus of control. So our students might, or our children might feel like instead of feeling like they have control over their own choices or outcomes, they feel powerless or like things just happen to them and they're controlled by others. Sheltering from reality and stress, they may avoid challenges or responsibilities because they feel too overwhelming to them. So they just avoid getting involved in things. Increases fear of risk and failure. You might see your child being overly afraid of making mistakes. So instead of trying a new situation, they are just worried about failure, so they don't try. And then in high school, eliminates connection with others. So withdrawing from friendships or withdrawing from activities that they might have used to have been comfortable doing or excited about doing. discourages skill building. They may avoid challenges again, so avoiding practices or important things that they used to be involved in, and then decreases independence and self-esteem. So their teens might rely more heavily on others. They doubt their own abilities, they feel less confident and in handling those responsibilities on their own. So that was kind of like the signs. And then now we want to move into strategies for all ages. And we've categorized the strategies that we can try to support our children into 3 categories: preventative teaching, healthy habits, and relationships. So we're going to start with preventative teaching. First of all, this is something we do a lot in elementary school, is some preventative teaching. We spend a good amount of time in class, and I teach guidance as the school counselor, doing things like teaching kids about feelings. And the young children, we spend a lot of time talking about different feelings and identifying triggers. And then we move into coping skills and how to manage ourselves and what are things we can try in order to keep those feelings under control. So positive self-talk is a big one that we talk about our inner coach and our inner critic. And if your inner critic is talking to you, then I will challenge kids to express a helpful thought instead of an unhelpful thought. Goal setting is another preventative teaching piece. So just starting with small attainable goals, and then celebrating when those like baby steps have been achieved in order to achieve a bigger, broader goal. Parents can help by just modeling feeling identification, letting kids know when you're feeling frustrated or when you're feeling overwhelmed, validating their feelings when they have them, even if you might not fully understanding them, just repeating the feeling to them, especially in young children, is validating for them. And then also normalizing asking for help. It's okay to not know all the answers as a child, even as an adult. I don't know all the answers. I say things like that to children quite often. So the goal is not to never have big emotions, but to be able to recognize them and to work through them. And I just always tell kids that balance is important in life, and we're not always going to feel 100%, and it's okay to have negative feelings sometimes. You just have to find a way to work through those feelings. Next, I was going to speak to healthy routines. So this is really important. I feel like maybe more important than the others. Physical activity, just getting our kids doing something, getting them off the couch, getting them outside and fresh air, recess, PE, sports, all of that counts. The screen time balance, I know Emily talked about screen time some, but just really having a handle on how much time our kids are on the screens, finding a way to monitor that, limiting their use of, and I have a middle schooler myself. I know how much she enjoys TikTok and Snapchat and being on those social media platforms, but just again, balancing that with the rest of life and finding a way to monitor how much time our children are spending on those social media apps. And then also at bedtime, keeping electronics out of the bedroom at night. It's so tempting for our kids to get on a screen when they can't fall asleep, and just promoting the positive sleep habits of not using a screen to help you sleep. And then morning and evening schedules, having consistent wake times and sleep times. Aim for 9 to 12 hours, especially for those little guys, those little kids. Create a calming bedtime routine. It could include, bath and then reading and then maybe journaling or just talking. Finding a time to talk with your child is also really important. Bedtime talks are a great time before they fall asleep. Lastly, under healthy routines, we had nutrition. So fueling your body and brain with healthy food, just trying to fill their plates with the fruits and the vegetables when we can. And I know that can be hard when we're all on the go all the time, but just doing our best to get those in when we can, limiting caffeine and avoiding any kind of substances that might alter their state of mind. And then the third piece is relationships. So I was kind of speaking to that a minute ago, trying to find strong connections with our children, or even, sometimes it's good for them to have strong connections or I know it's good for them to have strong connections with adults that aren't parents also. So getting them involved with sports. Again, Emily was talking about overscheduling, obviously, again, a balance, but finding some extracurricular activities that they are interested in, or mentoring, peer connections. It's important to teach our kids conflict resolution skills. And again, that modeling piece is really important with that. So just modeling good conflict resolution skills yourself as you're working through things. Parents can help finding ways to engage in with your child. Uninterrupted conversations are great. I call them car conversations sometimes because if you're in the car and you're driving somewhere, it's a great time to just talk with your kid. I've learned myself that forcing them or asking too many questions doesn't really always go well. And so just making sure there's a chance for them in their day to talk to you. And maybe they, not every day they might not have something to say, but just giving them the opportunity. And then modeling healthy communication, I talked to that. Help your child identify support people in home and at school. So lastly, I was going to speak to some coping strategies that we teach here at school, and you're free to take what you want from what I say here, and some of them you may already be well aware of. But the first one is thought stopping. So that is when you want, if like a unhelpful thought, your child says something along the lines of, I miss my dad if dad is out of town, instead of validating that they miss their dad, but then a helpful thought, like, I know my dad's going to be home on Friday, and saying something helpful that can help encourage positive thinking with that. Distraction is another coping strategy, distracting them from the feeling that they're having. And that doesn't always solve the problem, but it definitely can bring down the temperature of the moment. So if we're having a really frustrating moment, a really angry moment, distracting them with something that, reading a book, coloring, even just starting to talk about something that is off topic or off whatever it was that was making them mad. Positive imagery is just, I use this with my kids a lot. Think of something that makes you happy. What makes you happy is a good coping skill to try. Think about your friends and your family and the vacations that you took, things like that. And then relaxation, by that I just mean like practice deep breathing. In my class, sometimes I'll say, all right, smell the pizza, cool the pizza off. And we all breathe in deep and then we breathe out, and just taking that time to take a deep breath. The last coping strategy I have here is grounding, and grounding is where you use the five senses. It's kind of somewhat of a distraction technique also, but you think of 5 things you can see, 4 things you can feel, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. And kids say them out loud to me when I practice this with them. And we always talk about how taste is the hard one. And it's like, well, what do you taste? And they'll say like, oh, I taste my toothpaste, or I taste the pizza I had for lunch, or I just taste my saliva. And we always kind of giggle about that one. So those are just some ideas to try.
So thank you, Justine. I'm gonna follow up on that with some coping strategies for older kids. I want to reiterate, though, that everything that's come before this is for everyone, right? My coping strategies right now are really just a higher level of thinking for our older students. So that calm thinking is for older students, we would call that reframing. So just like Justine was saying, I'm sad because my dad is gone. A reframe of that would be my dad's going to be home on Friday and I'm excited because of that. So we use that language with our older students. How can you reframe that? How can you think about that differently? Calm body, again, we're back to that regulation and relaxation. A lot of times when our older students in particular are struggling and we tell them to breathe, that actually makes them more mad. So using that grounding activity of the 5, 4, 3, 2, 1 is, like Justine said, a great distraction, but it's also a way to be where your feet are. I love that saying, where you can be where your feet are. I'm going to be here right now. I'm going to scan my environment right now. I'm going to focus in on maybe the person that's talking to me right now so that I can get to a place where either I can move on and go to the next thing, or I can talk about what's really bothering me. And that leads right into safe actions. What can I do? What are some activities that I can do? I can talk to someone, whether it's a friend, another adult, a sibling, or I can put things down. For me, language is really important. So if you tell me to journal, I'm out, not doing it. If you tell me to do yoga, I'm out. But if you say, hey, write something down, okay, I can write it down. If you say, oh, stretching is good for you, oh, I can stretch. So knowing the type of language that works with your kid is really also important. Sometimes we balk at something when we have an idea of what that might be, right? Yoga is sitting quietly and making your mind blank, which I don't think I can do. But stretching, I know I can do stretching, right? What's the difference? It's just semantics, but it makes me feel better. And then I'm more likely to do that action. I wanted to also talk about when we're talking with our students and we're naming and identifying like emotions, I really want to be clear that most of our students, regardless of their age, talk about being happy, mad, or sad. And there are so many more ways to identify how we feel in our language, and modeling that, as Justine was saying, is so important. So saying out loud, it seems like you're frustrated with this activity, or it seems like you're very nervous. Or saying sometimes feeling nervous is also feeling excited. What's the feeling in your body? Is your heart pounding? Do you have butterflies in your stomach? What's it feeling like in your body? And then let's help you name that. I think that's where a lot of our students struggle, is they don't know what to call something. And now that these words of anxiety and depression are all around us, as Emily was saying, we have all the social media talk about being anxious and about being depressed. Now students are latching onto that language and saying, I feel anxious. And what we want to talk to students about is you can have a feeling and take an action anyway. You can feel anxious or frustrated or nervous and do the thing anyway. And that leads me to talking about the traps that we as adults get into that serve to prolong a student's feelings of anxiety or depression, or amplify those feelings. So I'm going to talk about parent traps, and I'm going to talk about school traps. For parents, my first one is the parent as the hero. That is when we want to swoop in, put on our capes, and save our kid from anxiety, save our kid from the situation that they've identified as making them feel a certain way that they want to avoid. When we act as the hero and we act as that savior, we are decreasing a student's ability to feel like they can do it. They can try it. We're decreasing their ability to communicate what's really bothering them. When I say I'm anxious, there's a reason for that. What am I scared about? What's my fear? What do I think might happen? There's a lot we can talk about around that and get to the root and then come up with a solution rather than just saving them. So, for example, at the high school, that might be a student feels anxious about speaking in front of the classroom, and the parent and the school make a determination that, oh, the student doesn't have to talk in front of the classroom. Well, when we think about long-term effects of that, that anxiety is real. It's not fake, right? I do feel anxious. I do feel nervous. What if? I have all these what ifs, right? That somebody might laugh. I might say the wrong word. I could sneeze. I don't know. Things that make me feel embarrassed. Those things could happen, but you could do it anyway. So, avoiding being the hero allows for that belief in self, the validation that even though I feel a type of way, I can try it, I can do it, and the ability to communicate with others about what are my feelings and what do I need to do. And what can I do even though I have those feelings? When we're talking about the parent as a shield, that's more when the parent is the barrier, the protector. I'm going to get in front of this. I'm not going to allow this to happen where my child might feel anxious or my child might get a sense of sadness. We're back to that locus of control piece. The child may begin to feel as though they don't have control over their feelings. They don't have control over their environment and things that they can choose because the parent is always getting in front of that, sheltering them from stress. We all feel stress. Stress is a normal part of being a human, as is learning how to move through that stress. We get stressed. Okay, what can I do? And it goes back to using those coping skills. And it can increase the child's fear of failing. So I'm not going to try that because I might not be good at it. And my parent says I don't have to, so I'm not going to. And we want to give kids that feeling of it's okay to try things. If I'm safe, I can try something, even though it's scary. And finally, in the parent traps, I'm talking about parent as an interpreter. So that's when the parent is trying to explain away the kid's feelings or explain away the kid's actions. So this happens a lot when I'm talking to a student and I say, why are you struggling to come to school? And the parent answers, well, she gets really nervous in front of big groups, or, well, she feels this way. So we're eliminating right away that connection with another person, and we're discouraging communication. We're discouraging the child trying to understand, recognize, and label their own inner thoughts, right? So that I'm not saying that the parent is not saying what's the truth and maybe what the child has said to the parent on another occasion, but allowing your child to interpret their own feelings and say things in their own way gives them that sense of not only responsibility, like I am responsible for my feelings, I am responsible for my actions, but it helps build skills, the skill of self awareness and the skill of being able to communicate my thoughts and my needs. I want to take a second here to remind you to put questions in the chat, and we're going to get to those. I feel like a lot of what we've said may be generating, but what if this, or my kid did this? Please put those in the chat so we can get to them. We also want to talk about school traps, right? Oh, avoiding parent traps. How do you avoid parent traps? I got ahead of myself. I want parents to think of themselves as coaches. You're the coach. You're the person that is guiding your child through anxiousness and possibly depression, right? We're teaching our kids like, it's okay. It's okay to try, even if you don't succeed. You're promoting that flexible thinking, like, okay, what can I do next time? You're giving them opportunities to learn and you're building resilience. I think that's one of the most important things when we're thinking about a parent as a coach. You're building resilience, you're building grit in your child. Oh, I can do things, I can try things, and it's okay with my safe adults. It's okay with them if I try something and I didn't do that great at it, as long as I'm thinking about, okay, what can I do next time? I'm problem solving, I'm asking for help. So as that coach, you're asking your child, how was that? What did you learn? What can you do next time? If somebody else was trying that, what would you tell them? Validating those feelings. Oh, wow, you did that even though you were nervous. I'm so proud of you. That's so great. What do you need for you to feel successful? What can you do? So for me, a lot of times when I talk to students, I am trying to give them actions. What can you actually do? We can think about things a lot, right? We can have all these thoughts in our heads and what ifs in our heads. But when we take action, then we see, oh, I can do something and I can make progress towards something. I can affect those things by what I do. Now we're on the school traps. When we're thinking about things that schools do with every good intention to support students, um, we can amplify those feelings of anxiety, and we can teach kids that, well, if you're anxious, I guess that's all there is to it. One of those ways is through some of the accommodations that we provide to kids. For example, allowing frequent breaks. So we allow the student to leave the classroom, for example, multiple times. If they are having a feeling, they get to leave the class and stay out for X number of minutes before they come back. Now, are breaks good? Absolutely. We all take breaks. We all take time where, okay, I need a timeout. I need to remove myself from the situation, um, think about what I'm going to do and come back. What we don't want to do is encourage always taking a break, regardless of the feeling, because that encourages avoidance. That can create a cycle of more anxiety. Oh no, here I'm having that feeling. I have to leave. Every time I have that feeling, I need to escape. And that might not be true in every situation. So we don't want to teach that. We want to provide support versus allowing escape. When we're thinking about behavior plans again are good things, but we want to make sure that students don't feel punished for how they feel. We don't want to plan away from feelings. We don't want to increase feeling of embarrassment or shame because I do have these feelings and now I have to have a whole plan around my anxiety. Well, it does depend on how we are looking at those plans. Is it the school or the adults, the teacher? Is it their actions or is it student centered? Is it student actions? Okay, when you have these feelings, what are things that you can do and how can I support you? How can I help? Rather than the other way around. What are things that I'm going to do to either keep you from feeling this way or help you get out of feeling this way? And I did already talk about breaks a little bit, how that might discourage skill building, discourage building that resilience and grit, and decreasing the ability to sit in discomfort sometimes. Sometimes we just are uncomfortable and that's okay. Um, and reinforcing that we need to be rescued when we aren't feeling at our optimal. Um, One of the things Justine said is that we all have bad days, down days. We all have times when we don't feel like doing something, and no, acknowledging that that's okay and you don't need to be saved necessarily from that, is something that we definitely want to teach our kids. What are the supports? So we talked about, let's not get in a trap. What are some supports that we have at our schools? So in this room, you see 3 of your supports right now. We've got a school counselor, we've got a school social worker, and we've got your school psychologist. So every building has access to a counselor, a social worker, and a psychologist. I'm really fortunate. I get to be in this building all the time. Some of our school psychologists do have 2 buildings that they serve. Um, our school social workers serve multiple places, as Emily told you, and our school counselors typically are in one building as well. Excuse me. Every school has at least one counselor. Um, the secondary schools have multiple counselors. They teach lessons in the classroom and they do small groups with kids. Especially at the elementary level, they're going into the classroom and teaching lessons based on how we treat others, based on how we treat ourselves, those types of things. Our school social workers are available to provide coping skills and to help build resilience through one-on-one support. They also do groups. And then your school psychologist works with students both academically and behaviorally to work on those coping skills, whether it's how do I remain in class? How do I feel frustrated and not act out on others? How do I feel frustrated with my academics and get the help and support that I need? So every building has a place where you as a parent can go, a person that you can reach out to very specifically to ask for help and support with your student.
I, just really quick, also, just to add on to what you said there at the end, if you feel like your kid is really struggling beyond what supports are available at school, come to any of those people, your counselor, your school social worker, your school psych, and say, I can you help connect me with some of the community? Do you have suggestions if we wanted to seek an outside therapist? Do you have suggestions for us for that? We are more than happy to help connect you with those resources out in the community as well, beyond what we can provide within the school.
Yes, for sure. And you see here where we've got the influencers and websites. There is also the link to the family and mental health resources through PLC schools. So you can always go there as well to get some information. But again, reach out to your school. Just calling the front desk, they will connect you with somebody that can help you. We wanted to provide you with some things outside of this webinar that you could read or listen to, an app that you can use. So um, I know for Justine and I, The Anxious Generation is one of our favorites. That's a book by John Haidt, and it really does talk about those traps that adults can get into, that lead to more feelings of anxiety. And it gives really good suggestions for how to build resilience and grit in a child, and concrete things that parents can do to support their child in feeling strong, confident, and independent. Um, the PLCS Mindshift podcast, I highly recommend it. There's a variety of topics there, and they're all archived. So there is a podcast that does address anxiety, if you wanted to listen to that again. There are podcasts on a variety of topics. We just had one on cell phones in schools. So I highly recommend seeking out the Mindshift podcast. Like I said, all of the episodes are archived and you can listen to those at any time. And maybe you'll hear somebody that you would want to reach out to and get some more information from. A lot of our guests are from right here in this district. We also provided you with some influencers if you're into social media. We love Dr. Becky. Dr. Becky Good Inside is great. And then, like I said, we gave you the link to PLC schools, mental health resources, and then there's some apps that you can use. I'm sure you've heard of Calm and Headspace. Those apps provide some avenues to use those coping skills that Justine was talking about in particular, some of those breathing techniques, some of the sleep hygiene habits. So listening to white noise or pink noise or brown noise. Did you know that there's all different colors of noise to help you sleep? So checking out some of those apps that could support your child in feeling that they have the tools to move through their anxiety or feelings of depression, feeling like they have something that they can go to and help them to be more successful out in the world, which is what we want for all of our kids, right?
I have just speaking on the anxious parents, anxious kids, or anxious kids, anxious parents book. So genetics are strong a lot of the times, especially when we look at our kids with anxiety. We can generally tie some of that back to parents who might also have some anxiety about things. And we are all well-meaning parents and wanting to do the best for our children. And so, like Vern's parent trap, sometimes we fall into those with good intentions, but may set up our child to have more struggles. So this is a great book to help parents recognize what are some of my patterns perhaps around anxiety and my feelings around that, and how can I help not only work on myself to kind of put acknowledge and process and work through those so that we can then better support our kids. So those are really great book resources on there. I highly recommend. Yes, all of them. Agreed with what Vern said.
All right, we would love to answer your questions. You can drop them in the chat. I don't see any right now. But this is what your kids' teachers do, right? They ask, okay, what questions do you have? And everyone stares at them and doesn't ask any questions, but I know you have some.
I have a question. Hi, thank you. I have a 5.5-year-old, and I thought I was doing the best that I could, as a parent, a first-time mom. So I give myself grace, but I see him trying to do a lot of people pleasing, even with like his peers, just kind of like wanting praise from others, kind of like, oh, look at my painting. What do you think? Like, I just noticed that the other day I picked him up from daycare. So I'm just wondering, is that normal, or am I maybe praising him too much at home? Like telling him, good job, I'm glad that you're trying, or but now I'm kind of trying to like tone it down and just kind of tell him, don't, look for validation in your peers. As long as you think it's good, that's fine, but you don't need someone to tell you that it looks good, or you don't need to feel like you need to show others what you can do or what you're able to do to get them to like you. So am I maybe doing too much, like telling him that, explaining it to him since he's too little, or what can I do to kind of get him to not be a people pleaser?
I guess my advice is just that I think it's great to fill his bucket and to let him know how proud you are of him and that his work is great. I think just being, open and, maybe using kid terms of like it's you did a great job and you worked hard and we love the work that you've done, even if not everybody thinks that way. And
Mhm.
just being really open with him about that and about the feelings. And I understand what you're saying. However, I think just really supporting him and making him know that you're proud of him, because I think ultimately it comes down to like mom and dad are like going to be his
Mhm.
top people in his life. And
Yeah.
so just being his, biggest cheerleader and his biggest support is, and just being open with him and giving him a chance to talk to you, because maybe somebody has said something mean at some point to him, and just talking through that with him. I always tell my own kids that you want to surround yourself with people that are going to always be kind to you and always be nice to you. And if someone's
Yeah.
not being nice to you, then you want to find who is somebody that has always been nice to you in your class or in your,
Hmm.
and that's who you want to sit with at lunch. And that's who you should play with at recess, someone that's going to fill your bucket.
Okay, thank you for sharing that. I'm definitely going to do that now. Thank you.
I would add to that, just saying also praise when he tries something that maybe wasn't as successful. So if he's always showing you the good things, is always showing you the best coloring or the best work from school, that's wonderful. But also praising for you tried that. Oh, I'm so proud of you for trying that. Oh, what could you do next time if you wanted it to be better? Those types of things are allowing him to see that you don't only get praised when things are great. You get your bucket filled when you try something new, you try something different, you do something new. Um, we really want to make sure that we're giving him um, the independence and the freedom and the um, courage to do lots of different things. And again, back to what Justine said, knowing that mom and dad are cheerleaders no matter what, and they're supporters no matter what.
So I have one thing also to add, just building up that intrinsic motivation. So what are you proud of in the picture that you drew or colored or something? And are you proud of yourself for making that? So tying that back to just them, it doesn't always have to come from other people, but having them identify um, what what they worked hard on, maybe a sticky spot for them that they had trouble with. And so similar to what Justine and Vern said, but tying it back to that own intrinsic being proud of themselves and not always looking for other validation of others being proud of them.
Thank you.
I want to address the question of mitigating parent pressure. I do think that's another trap that we fall into. Pressures. I want to say Emily talked about sports, for example, and that we are putting our kids in elite sports and they go to soccer at club and they go to soccer at school and they go to gymnastics and all the things. And it kind of feels like you have to do those things or else your kid's not going to be wherever they need to be. And I would say that I would respond to that question just as I would to a student question is why do you care? Thinking about, is it truly going to make your kid better? If that's the goal and your kid wants that, awesome, let's do it. But if it's, well, I have to, or else they won't fill in the blank, then that's really for you and not for your child. So mitigating parent pressure is thinking about who am I doing this for? If this is for the child, then maybe that isn't parent pressure. It's just kind of, oh, this is what we're doing for our kids. Okay, I want to do that. This is good for my kid. I'm going to do that as well. If it's really so that you feel better, then don't do it. And that's easier said than done, I know, but that's really the thought I'd like you to have is who is this for? If it's for me to feel better, then I need to work on why I need that. If it's for my child, I need to work on how does that work in my family.
One thing that I was just going to add on to that, and I don't know specifically what kind of pressure the parent was referring to, but we see some academic pressure from parents sometimes here at school. Oh yeah, school and grades. Yeah. So I think just letting your child know that you're proud of them as long as they tried their hardest. And if that doesn't result in, an A or a high score on their MAP test, as long as they tried their hardest, that makes you proud. And letting them know that you feel proud of them, regardless of if they scored the best out of the whole class or not. I do think that sometimes as parents, we unintentionally put too much pressure on our kids with grades in school. And so just being really open in the communication you have with them, that you're proud of them for trying and you're proud of them for giving their best effort.
My daughter is in third grade and she asked me the other day, she said, what are grades? What if I get an F? Will you be mad at me if I get an F? I'm like, you're still getting like satisfactory in passing. But part of the conversation we have is just like, if you do, we'll figure out like what are you not understanding, and we'll try to help you figure that out and to boost that up. There is a lot of pressure on grades. Absolutely. That is just how kind of schools run. We know that it's not ideal. But yes, so letting them know you're proud of them if they try their hardest and helping them figure out like if there's something you're stuck on. You need to talk to your teacher, first of all, like not let's talk to your teacher. You need to talk to your teacher, figure out what kind of supports we can put into place to help you get caught back up.
Great questions, everyone. We'd love to have a couple more. You can go ahead and unmute if you want to, or drop your question in the chat. While we're waiting, Emily and Justine, are there any other things that we want to make sure we leave parents with before we wrap up?
I was just thinking about like some of the coping skills I was talking about earlier, and I thought of one other thing I do with kids, like in the moment, if I can tell we're having like some real anxious feelings or we're nearing, a panic attack or something, I put my hands on my chest with kids and I'll just mirror taking deep breaths with them. And sometimes they don't do it back with me, but at least they see me doing it and they see me modeling that taking a deep breath. And I'll do that with them. And just another strategy to try or to have in your toolbox.
I also had some thoughts on that section, and it was something that I had seen again on social media because my algorithm. But that coping strategies, the deep breathing, all of that is not when we're talking about like, especially like clinical level depression and anxiety, a deep breathing is not going to get rid of your anxiety and it's not going to get rid of your depression. It is a tool to help you move on to the next step. And so there's this whole regulate, relate, reason from Dr. Bruce Perry, and it's wonderful. And there's so much information we couldn't fit it all into this today. but that deep breathing, those coping strategies are to help regulate your brain system and your body system and all of that that's going on so that we can move to like, let's make a relational connection, whether that's parent to child or school staff to child. And then we can talk about what's going on, and how do we process through that or move forward or do something differently in the future. So I, like Vern said, if you tell a kid to take a deep breath, it's going to make them more mad sometimes. But there is a place for that of like, we're going to do some of these strategies to help calm our brain so that we can move on to the next step. And then we got one more question in there too.
And then, so yeah, Melissa, I believe that this is not uncommon, right? Where kids are just scared to take a risk. They're scared to fail. They're scared that, what if I fall? What if I fail? What if somebody sees me and they laugh at me? Those types of things. I don't know how old your child is. If your kid is little, one of the things I recommend is you do something with your kid that is also new to you. So whether that's you go roller skating or you go do pottery or to a painting place, something like that, where you're both new at something and you're trying something so that she can see, yeah, trying things are okay. My mom tries things. My mom doesn't get everything right, and we can laugh about it. We can still have fun. It can still be rewarding, even though it's not something I'm already good at. And then not allowing for quitting. So when a kid commits to something, they commit and they're going to see it through till at least the end of the season, the end of the semester, the end of the class, whatever it is. So even though you feel like you're doing poorly, or even though it's hard, we're going to see it through to the end. And that helps to build resilience. Emily?
Also just going back to that goal setting of setting a goal and the small steps and celebrating wins. So trying to figure out what is something your kid wants to do or would love to be able to do if they could get themselves there. And then how do you work backward from that on small steps? So let's say like take sports, for example, if they don't want to try out for a team because they're afraid they won't make it or afraid of failing when they get there, could they do a 2-hour camp in that sport with a friend sometime just to show up? They have a safe person. They don't ever have to see those people again if they don't want to, but trying to like find that goal and then just work on little things of like, what could you do? What are you willing to start with? Building some coping strategies into that, and then trying to build upon that.
I'm seeing a timer go down. I just want to make sure. Is it only a minute left? Is that what it's saying?
I think so.
Okay.
I'm gonna put the registration for the next one in the chat while we still have less than a minute. That one is on October 15th, same time, 12 to 1. It is on Understanding Advanced Placement. Again, if you have registered, you will get the recording for this. I think they will be up on their website. Christopher Villarreal, our communications director, was not able to be here today to confirm that, but I believe that that is how that will work.
Thank you, everybody, for attending, and feel free to reach out if you ever have any questions. Any of us would be more than happy to answer any questions or talk through anything with you.
Yes, thank you. Thanks for joining us on our inaugural Empowerment Collective session.